Welcome back. We have Dr. Acharya here, Cone Heart Health Vascular Medical Director of Cardiac Imaging. She's talking about heart health and the importance of getting this calcium heart scan. And I think, I know we talked a little bit about what is the scan itself and that it's not like any kind of injection or anything like that, which is great. Let's talk about what happens when you're reading the results. And it can go from 0 to what?
Thousands, unfortunately.
Okay.
So, like I said, we like a score of 0. Anything less than about a score of 100, we still lump into kind of a lower risk category. As the score approaches and passes 400, we start to place those patients in a slightly higher risk category. That doesn't necessarily mean you're going to have a heart attack, but it signifies that there is a burden of plaque there. There's a lot of plaque there, and we maybe need to be more aggressive about your risk factors. I use this test, like I mentioned, to put my patients on a little bit more cholesterol medicine, a little bit more diabetes medicine to really control that coronary artery disease best we can.
If someone is thinking, you know what, I heard her say that it's, about $90 or $99 and it's not paid for by insurance, and they're thinking, I'm going to use that 99 bucks for something else. What would you say to them?
I would say, this test is validated for anybody above the age of 45. That doesn't mean you can't get it at a younger age, but that's when we can start comparing you to your peers based on big databases of patients we've studied over the years. I'm going to have mine done as soon as I'm 45. I know that for a fact. And so what I would say is don't wait. Don't wait to get this test done, especially if you have a risk factor, including, again, I keep saying them, diabetes, high blood pressure, high cholesterol, or a family history of heart disease. This may be your first indication that what runs in your family may be something that can affect you as well. And we can get to work much sooner on your risk factors and really prevent you from going through the same thing that perhaps a family member did.
All right, so that was going to be my follow-up question. So if you do have a family member who either has high cholesterol or who has some cardiovascular disease, but you're not feeling any kind of symptom whatsoever, then you think that this is something that should be done as kind of a blanket thing to mark where you are?
I do. I really do. I think this is a test. It's information, and information is power. It empowers the patient to know, wow, my calcium score is 0. That's great. Maybe if what I'm doing is really working. Or, okay, my calcium score is 1,000. How do I get more aggressive? And how do I take even better care of myself? Absolutely. I think it's the right test for almost anyone. And again, it's really safe for those patients who aren't having symptoms, just as you mentioned, Tanya.
Okay, so we all need to take better care of our hearts no matter what. So what can we do to do that?
Well, first and foremost, get moving as much as you can. Exercise about 30 minutes a day if you can, 5 days a week. That will actually tell you if you're starting to feel something that you can't exercise to capacity, you're short of breath. That may be another first sign that you have to go in and at least speak with your primary care provider. Eating a healthy diet as much as you can. I tell my patients the Mediterranean diet tends to be a good one. And really, it's fresh fruits and veggies, lean meats, and fish. That's really what it boils down to. Know your numbers. We say that a lot when we come on to speak to patients and speak to the community. Know what your numbers are and know what they're supposed to be. Know what your diabetes number goal is and your cholesterol goal. You and your doctor can work together to take medication that will lower it, but also do what you can from your side, exercise and diet, to lower those numbers.
Okay, so we've talked about the heart scan calcium test for the last, like 7 minutes or so. But if people are like, I'd really like to look at a little bit more information about it, where can they go to learn more about the test?
So there's a Cone Health site, conehealth.com/heartscan, where you can learn more about this. And it should have plenty of information how to get it scheduled and what the results will be.
Okay, and you don't actually have to go to your primary doctor, or you can go to your primary doctor?
You can get this scheduled kind of through any of your health providers. I think it's always important to run your story by a kind of a trained medical professional. That way we can really parse out for you, is this something where I think we bypass the calcium scan and go straight to stress testing or something more? Or do we kind of scale back and say, no, I think a calcium test is appropriate for you, and go from there? So from that standpoint, I would say maybe it's good to run it by somebody who's looking after your health.
Right, on a continuous basis, and they know you. All right, thank you so much for your time and your wisdom. For those of you who may have missed any part of this, you can find it on our website in the To Your Wellbeing section.